There are a multitude of benefits to the doctor for CareStack. Number one, having access to your data from anywhere. But imagine you go on your iPad, you go on some device, you look up the patient, you see their x-rays, you have an idea what's going on, you have their medical history too. So you know how to prescribe something. You can literally, in CareStack, send that prescription electronically and they go to the pharmacy and pick it up. It allows our doctors to take better care of their patients. Everything is in a very graphical, user-friendly interface. So when you're looking at things, it's not archaic, and it's also easier when it comes to presenting to the patient, because not only do they have a treatment plan, but they have an explanation of what those different things are with little visual tools. One of the things that's beautiful about CareStack, not only can I generate graphical reports and reports instantaneously, but they actually have predictive, and I call them KPIs, key performance indicators, that show me how booked out is my schedule in the future, how booked out is my hygiene schedule, what does it look like my production is in the future, where are my holes, where are my strengths. When we first started with CareStack, my staff count at the front desk of one of my offices was 5 people. Today, we're seeing 30% more patients, we have 30% more visits at that same office, and we're doing it only with 3 people, and those 3 people, their workload is less than what it was before. Pre-CareStack, our treatment acceptance was around 40%, right? Which is almost double the national average. When we went over to CareStack, and it took about a month for everyone to become very familiar, our treatment acceptance went from 40 to 45%, went to 50 to 55%. That's not a 10% jump. That's a 20% increase, right? And it allows us to see more patients, take care of patients in a better manner, and we got more patients to say yes to treatment. Great for the patient because it saves them money in the future, and great for us because it helps our revenue go up. One of the great things about CareStack is, in the world of dentistry, when you do work, you submit an insurance claim and then you wait to get it back, right? The old way is patient would come in, we'd print up a claim, we'd put it in an envelope, we'd send it out. Hopefully the insurance company would get it, hopefully they would open it, and then they would send it back to us. So our typical turnaround time from the actual procedure to when we would receive a check could be, on average, 45 to 60 days. Today, the next morning it goes out digitally, and if there's anything wrong with it, by the way, it gets rejected, so we know right away. And then we have something called ACH, right, which is check payments that go right into the account. And typically, when we submit a claim, we'll see an ACH literally within about 5 business days. We had all of these other modules that would plug into our practice management data. There was one for appointments, there was another one that we would use for metrics, there was another one that we would use for confirmations, there was another one that we would use to scrub the data for recall if a patient hadn't been in a certain time. And all of these different modules that we had a monthly subscription price to it. So it's not like you just paid once for it. And on average, each one was $300 a month for each office. I mean, we were literally spending per office somewhere around $1,200 to $1,800 per office just for the modules to get the data, and the data that I get from CareStack today is so much better. I would have one person managing this module or 2 people managing this module. If the person was out sick or the person was on vacation, so I ended up becoming an expert in all of those, but not best use of my time either. We're 7 locations. We'll always pilot something in one location, but I get real-time data, I get predictive data, which lets me know, do we continue down this path or do we scale it back? But one of the things that I learned from CareStack is I have so much more room to grow just in my oral surgery department.